see. Good morning, afternoon, evening. My name is Dr. Renata Hedrington-Jones, and I am a faculty member at Walden University. And today we're going to talk about um, stress and self-care and the importance of wellness within. And I am a core faculty member in the School of Social Work, Barbara Solomon School of Social Work at Walden University. I believe and I know that social work is one of the most phenomenal professions ever. We have the ability to do great things and impact social change in the world. And I believe that as we move forward, that we need to be involved and concerned with those things that impact us most. And one of those things is stress. And so the first slide, please. Okay. So how do we know we are stressed? A lot of things we take for granted. When we have a headache, we think if we take a Tylenol or whatever, that we'll be fine. But headaches are usually a sign of stress. Trouble sleeping. We toss and turn all night long and we don't know why. And some of us prefer to watch television, listen to music, keep ourselves busy, and don't acknowledge the fact that there's some other things that are causing us to have sleepless nights. It's like when you wake up in the morning, you feel like you just fell asleep because then you haven't had a restful sleep. And that is sometimes the stress impacting us. Jaw pain. We grind or grit our teeth at night. We don't know we do that until the doctor tells us we've damaged our teeth. What often happens is we grind and grit our teeth, we snore, and when people tell us that's what we do, we deny it. So again, we are denying those things that are happening to our bodies that are indications of stress. Change in appetite. Some of us are very, very happy when we don't eat and we don't eat appropriately. And we think that either we're gaining weight, losing weight, or we're doing what's right, or we're not hungry. It's a response to the stress in our lives. Some people overeat, some people undereat. Some people don't even know that they're hungry because they're so stressed out and their bodies, minds are all involved in something else. Frequent mood swings. Women are made to believe that all of our mood swings are hormonal. They are not. We say we eat chocolate because it's our time of the month, or we're moody because it's our time of the month, or we have problems because we've gone through menopause. I can remember when I was a child, the older people saying that some women were crazy because they menopause ran them crazy. Well, at my age now, I really understand the craziness of menopause. Now we like to use very DSM-5 diagnosis to say what's going on. However, mood swings are serious behavior issues. A person doesn't snap from one extreme to the next. We use that, so it's sometimes stress and our response to stress. We tend to respond to what bothers us, what hurts us, what makes us uncomfortable. And stress does all of that to us. We have a hard time concentrating, and it's like we'll contribute that to our plates being full. We have so much to do, we can't remember. No, it's stressful doing what we do. And sometimes we feel overwhelmed. And actually, when you think about it, it's nothing really wrong with being overwhelmed or being able to acknowledge that you're overwhelmed. That gives you a point of entry to resolve those issues that are causing those emotions. Again, look at the stress in our lives. So, women tend to think that we can do everything because we are super women. Every woman, any woman, just here last week, I had a group of women and we talked about being stressed. And one of the things I keep reminding women about is stop passing off our peers, our female peers especially, as being complainers, whining, crying, all of those negatives that we indicate or we see as indications of weaknesses. Sometimes we need to listen and allow people an opportunity to vent. We're not everybody's sounding board, but we are supposed to be sensitive to the needs of others. Not just because I'm a social worker, but because we are human, we are women, we are sisters, and we need to be more compassionate and passionate about what it is we do for and with each other. So acknowledging stress does not mean you're a whiner, does not mean you're a complainer, doesn't mean you're not strong. It means you're stressed. Now, we need to understand that stress is manageable. It is within our control. I was listening, and I've mentioned before, Dr. Minishu says that we should not allow anything to be out of our control that involves us directly. For instance, if you have a friend or an acquaintance who always has a way that they stress you out, or they bring you things that aren't really factual and you respond, or whenever they're around, there's an argument, disagreement, or negativity. That's an indication that you need to limit, decrease, or eliminate that person's coming into your space. And your space is anything that you respond to, whether you hear it, see it, or feel it, is in your space. So be mindful of that. And scientifically, our brain is exposed to increased levels of hormones called cortisol. And cortisol will weaken your immune system, making it easier to get sick. And this is what long term stress will be. So when you have people who say their immune systems are low or weak, remember what impact you can have with stress in addition to that low immune system. And so when you are not getting enough sleep, you're more susceptible to stress, not having a network of support. Now, I speak primarily to women, but men get stressed too. So when they're stressed, you're stressed, we don't need to have a party together. We need to have a means of resolution, a means of response. So experiencing a major life change makes you vulnerable to stress. Moving, the death of a loved one, starting a new job, having a child, getting married. That is why frequently we talk about um, postpartum depression and the impact. We are now seeing increased levels of suicide amongst women. What was very concerning to me was recent research saying there's been a significant increase in African American and their African American women and their suicide rate. That was stressful for me because historically, African American women have not been participants in suicides. So that is something for all of us to become more aware of. Experiencing poor physical health, if your blood pressure's up, you're more vulnerable to stress. If you have allergies, you have colds, sinus infections, anything that breaks your body down causes you to be more vulnerable to stress. Not eating well. My mother would say, breakfast is the greatest meal of the day. And so breakfast is also more than a cup of coffee or a cup of tea. Breakfast means that you should eat something more substantial to hold you up for that day. So, in closing, I would suggest that we recognize what triggers are for us for stress. You accept those needs that you have and work on resolving those. We need to learn to manage our time better. Calendars work. So I am a firm believer in I have a 3-year planner, and I try to put everything on my calendar. And so when I have a number of scheduled events for one day, sometimes that's enough for me to have in a 3-day period of time. I'm managing my time, I'm controlling my level of stress, I'm controlling vulnerability, I'm controlling my response to having a full day. You know, if you have 5 appointments in a day, you need the next day to recoup. If you don't, you're going to respond to everything that happened the first day. You're going to respond to it sometime within that week, which is going to make you not be at your best during that week. So, prioritizing your activities can help you use your time well. Practice relaxing. We, most of the time, we think that we are cheating, we're doing something wrong, we are being a bad mom, a bad wife, a bad friend when we relax. We owe ourselves a period of relaxation. When we can also pray, meditate, yoga, quiet time. We have to choose what fits us best to relax. So that will take us some time to learn ourselves because we really don't know ourselves well enough to know what it is we need. I practiced for years staying in the car before I get out, whether I listen to the radio or just I'm quiet. And I breathe and I breathe and I breathe. And it's to get out all of those things I've taken in for the day. And we all talk about exercising, and that's something that's pretty hard for a lot of us to do. So we have to make sure it's fun, have the time, and try to make a commitment to doing that. Sometimes we, again, think we're cheating somebody else when we're alone. And one thing I've learned and I've been more involved with is trying to get or impress upon people the importance of understanding and knowing the difference between alone and lonely. So we have always lived, and no matter how many decades we go back, we can't talk about or we can't point out when it began. When, as far as I've been taught and can remember, everybody impresses upon you the importance of you being able to be in a relationship. Why you're not married yet? Why you don't have children? And this is the way they say it, something's wrong with you. No, I'm happy with myself. We have to get to that point, or as the stress of all of that will take over. So it is every individual's mind set as to what it is you do, how you do, what makes you happy, and do that. If you want to go to the park by yourself, you want to go to the movie by yourself, if you want to read, if you just want to be still, that is a factor for the stress. Okay, eating well. It is so hard for us to do that because we eat on the go, eat in the car. So, what we need to start doing is to eat and sit down so we can enjoy our meal. You know, a lot of us will eat on the run, so we have to eat better, get enough sleep. It is very, very hard. And some of us, and I say us collectively, oh, I only need 4 hours of sleep. No, we need 8 hours plus of sleep because we have to always be prepared. Alcohol and drugs will help us to overcompensate for our stress. So we have to avoid those items or substances when we know we're stressed out about things because I had an uncle who was an alcoholic, and we used to say to him, the same feelings you're trying to kill with the alcohol, they're not gone away the next day when you sober up. So, whatever the stressful events are in our lives, we have to acknowledge them, deal with them, and show where they are and where they have taken over in our lives. And remember, we're supposed to be in control of ourselves. And so, the best thing we can do is talk to someone. I know for many people, um, they align talking to someone, especially a practitioner, as being a horrible thing. It is not. We can go to counselors, therapists, friends, and we always have to be assured that those persons that we're talking to are going to hold what we tell them as confidential as possible. Because again, we increase our stress level when we don't trust people. And that does not mean we go and trust everybody. Because the truth of the matter is, everybody we choose as a friend is not always a trustworthy friend. So you have to make certain that when you're talking to people and sharing what's stressing you out, that there is um, a sense of truth, confidentiality, honesty, and that that person is just talking to you, because we don't want to add to the stress. So we are worth the time to be stress free. We're worth the time, and we have to be able to identify and admit that we are stressed out. We can be stressed out. We are vulnerable, but we have to take care of ourselves. So I hope this tidbit of information helps you understand better of the stress and the fact that self care works. And it's only going to work if we're willing to be honest with ourselves and identify those things in life that stress us out.